Hi, I'm Aarushi Guin, and today I will be discussing the impact of pesticides on global health, developmental effects of chloropyrifos. So, a little bit about me. I'm a rising senior at Fulton Science Academy in Alpharetta, Georgia. In the future, I would want to go to medical school to become a cardiothoracic surgeon, and I enjoy participating in the high school science Olympiad team and coaching our middle school science Olympiad team. And in my free time, I like hanging out with my friends and playing volleyball. So this is a familiar household product which can probably be found in 90% of households with a yard. It is a weed killer called Roundup. So in January, the manufacturer of Roundup was ordered to pay $2.25 billion to a Pennsylvania man who sued the company, alleging he developed cancer from exposure to Roundup. So this raises questions about the safety of the use of other household chemicals as well. It is especially significant in a world where 10 million people die from cancer every year, making it the cause of around 1 in 6 deaths and one of the largest health problems globally. For the majority of such chemicals, the exposure happens due to lack of knowledge about the long-term risks. The chemicals have become so intertwined with the ecosystem because of rainwater runoff and airborne dispersions that most people are unaware of the exposure. It is therefore important for us to study the effects of these chemicals on the human body and to raise consciousness about their current and potential future impacts on global health. So, in this research, I have conducted experiments to establish the relationship between an organophosphate insecticide called chloropyrifos and the developmental effects in the frontal cortex. Chloropyrifos, or CPF for short, works by inhibiting acetylcholinesterase, which is an enzyme essential for proper functioning of the nervous system in insects. CPF has been linked to decreased IQ and increased symptoms of ADHD in offspring of women exposed to CPF during pregnancy. The scary thing is that CPF is not only impacting us, but also our future generations. We know that CPF is causing these effects, but we do not know what specifically is changing in our brain for these effects to appear. So, this study aims to investigate specific effects in the frontal cortex of the brain in neonates when the mother has experienced exposure to CPF. Studying these effects provides us some visibility into what other diseases or birth defects that CPF could potentially be causing. Since previous studies have had success with studying the effects of other substances by studying their effects on the levels of proteins such as N-methyl deaspirate receptor or NMDAR, gamma transporter 1 or GAT1, vesicular monoamine transporter 2, VMAT2, and tyrosine hydroxide or TH. I used the same set of target proteins in my study. For this study, 20 mice were used, 10 male and 10 female. 5 from each sex were from the control population, and the other 5 were from mothers who were exposed to CPF during pregnancy. The mice were euthanized at the age of 4 months, and their brains were snap frozen until use. The frontal cortex was separated, and the protein was extracted. A Western blot was done for the different proteins. This involved the standard steps of polyacrylamide gel electrophoresis, electroblotting, antibody incubation, identifying DAT antibody binding with the luminescence signal, stripping and reprobing the membrane, and finally analysis and quantification. For the analysis, unpaired students' t-tests were performed for comparing the groups with and without exposure to CPF. Males and females were studied separately in this analysis. The statistical significance was reported at a 95% level. So let's take a look at the results of these tests. The levels of GAPDH were observed to be equal between the control and treated samples. Since GAPDH was used as the loading control, this validates that the results can be truly attributed to the CPF exposure and not simply a result of procedural errors. So as we can see in these graphs, the TH levels in the treated males are as well as the females were higher than the control. According to previous literature, increased TH expression is associated with an increase in chronic stress, which decreases the working memory. These plots show that the treated mice were observed to have higher levels of VMAT2 than the control. However, Parkinson's disease has been linked to a decrease in VMAT2 expression. Since the results indicated an increased expression of VMAT2, both the male and female mice the risks are potentially minimal. In these plots, we can see that with CPF exposure, the expression of NMDAR decreases in males but increases in females. A reduction of NMDAR is linked with diseases such as depression, schizophrenia, and other cognitive deficits, while an increase is linked with Huntington's. GAT1 increased in treated males and decreased in females. GAT1 is interesting because it inactivates GABA receptors. A reduction in expression of GAT1 could indicate that less GABA is being recycled, meaning more of it is able to interact with GABA receptors. So in females, since NMDAR is increased, that GAT1 and GAT1 has decreased, it could indicate that the increase in NMDAR is leading to an increase in neuron excitation. So the reduction in GAT1 is a compensation mechanism that is trying to reduce this hyperexcitation. So my research provides conclusive evidence that that changes are being induced in the protein levels in the frontal cortex due to exposure to CPF during the developmental phase. Previous studies have shown that protein level changes are indicative or risk factors for several diseases such as Parkinson's, schizophrenia, Huntington's, and more. Therefore, we have strong evidence to believe that developmental exposure to CPF increases the risk of these diseases. However, we must acknowledge that these health risk determinations are associative in the study because this is not a clinical trial. While CPF has been banned from agriculture in the USA, the use of CPF still continues in other applications. Additionally, CPF is still used in agriculture in different parts of the world, which enters the global food chain through international trade. Therefore, it is critical to revisit the legislation and policies associated with the use of CPF to evaluate if further restrictions are required in a global context to save our current and future generations from CPF-related health risks. I would like to thank Dr. William Michael Cottle for his guidance throughout this research study. Here is my contact information, and thank you for listening.